I'm often asked what is the difference between all the different tapping techniques, and TFT, thought field therapy, is the original tapping technique, and it was discovered and the whole process was created by the wonderful Dr. Roger Callahan. And in essence, TFT can be very diagnostic. So using some basic muscle testing, you can diagnose specific sequences for different things. And what Roger did was, using this diagnostic process, kept detailed notes of every single sequence that he diagnosed for everybody. And what he noticed was there was a pattern. So for example, anxiety responds particularly well to 3 points. 70 to 80% of the time, it's the same 3 points in the same order, whereas trauma and anxiety responds better to 4 points. Something like anger responds better to something like jealousy. And so by diagnosing these and keeping notes, he came up with what we call the algorithms, which are these short sequences for specific emotions. If you compare that to EFT, for example, EFT uses all 14 tapping points all of the time. So it's a really kind of one size fits all. And you need to say out loud what the problem is. So it might be something simple like, even if though I have this fear of dogs, I totally and utterly love and accept myself. Whereas with TFT, you don't have to say anything. And I have to say, many of the most traumatic things that I've worked with, I don't even know much about, if anything, what I'm actually dealing with. So in other words, the person doesn't have to verbalize this awful thing that happened, which, if you're afraid of dogs and a dog bit you, isn't difficult, but it might not be nice. But if it's something really horrible, some really physical or sexual or mental abuse, to have to actually say that out loud can be a challenge. So I did do the EFT training and I tried it, and I'm not saying EFT doesn't work at all. What I am saying is there's essentially a difference, and the difference between the two is like buying something off the shelf or having something tailor-made. Because the way that I teach TFT is not just the algorithms, but I will teach you how to create individual sequences so that you literally can tailor-make the process to your clients, and they don't have to say anything out loud unless they want to. The other key difference is in using this spot here, which in TFT is called the Gamut spot. In meridians, it's actually the triple warmer. This is the meridian that's most responsible for fight or flight, and it's a very greedy meridian. It pulls things, energies and juice from other meridians. So we need to be able to calm that and sedate that. We also know that energy crosses the body. So you know your right hemisphere controls the left side of your body and vice versa. And when you're doing this work, you really want to make sure that energy is crossing over. So in TFT, there's a little sequence with the eyes. So you just move the eyes round and round, because that means you're going one hemisphere to the other. You hum out loud, then you count, because that again means you're going from one hemisphere to the other. And that just brings another layer to embedding the process and can make it really very, very quick. Also in TFT, and unique to TFT, is this concept of psychological reversal. And that's something that, as you'll see, can be demonstrated really easily. So if you arm test, so if I put my arm up, and let's say someone arm tested me while I'm thinking about someone I love, so let's say my daughter or one of my sons, and then they say, now think about someone you don't like, and I think about some heinous Jack the Ripper type character, then even with one finger my arm would go down. So that's a muscle test. But what happens is, if you measure it on a voltmeter, you can see the polarity flips from positive to negative. And we know that these two parts, the front and the back of the hand, are different polarities. That's effectively the top and bottom of your body, the same as a plus and minus on a battery. And that if you tap the side of the hand, that can help to bring that in balance. So if a treatment isn't working or you need a little bit of adjustment in your sequencing, rather than just one size fits all or not, you can correct a reversal and tweak the sequence a bit to make it even more effective. It just works so well with a lot of other energy-based therapies as well. When you don't have to constantly be speaking out loud, you can use other sensory-based techniques to really enhance the result for your client and get the best result, not just in the simplest way, but in the least painful way. And I think that's a huge benefit of doing TFT over EFT.